Hi, and welcome back to another episode of the Healthy Aging Network. Today, we're going to be talking with Dr. Karen Rose about brain health and heart health, so please stay tuned. Today, we're going to be joined with Dr. Karen Rose from the College of Nursing at Ohio State University. And I'm going to give Karen a chance to opportunity to introduce herself. So Karen, can you please tell me about you, what you do, and what also your center at the College of Nursing does?
Absolutely. Thank you, Kathy. It's great to be back with you. So I'm a professor of nursing at the College of Nursing at the Ohio State University, where I direct a research center that focuses on healthy aging, self-management of complex and chronic diseases, and complex care. So it's a real pleasure to be here. I've been a nurse for about 30 years, longer than I should maybe tell you. So lots of background with patients, and really excited to share with you some information about brain health and heart health today.
Great. Thank you so much. I know we've got a chance and opportunity to meet and talk about all the exciting things that you guys do and all the research that you're doing. So we really appreciate you joining us today. So we're talking about heart health and brain health. And I noticed you say it's the two sides of the same coin. So I'm going to give you just an opportunity just to share with us a little bit about the idea between heart and brain health. And then we'll go into some of the more specifics if that's okay with you.
Sure, that's great. So it's always been said that if you're good to your heart, you're being good to your brain. And they really are so interconnected, these two large muscles, if you will, of our body. So much of what we do in terms of cardiovascular health really does transfer over to brain health and vice versa. So many of the interventions, many of the best practices, many of the recommendations that we all receive about heart health really do have implications for our brain as well. So again, I've coined this two sides of the same coin, because really to speak of heart health, there are implications for brain health as well.
Thank you so much. So as we start out, let's talk a little bit about some of the issues that we're facing right now with our aging population, and some of those things that kind of stand out to you at the center and some of the research that you do.
Sure. So as we're talking about issues in aging around heart and brain health, we really have to look at the demographics of older populations. And so what we know, for example, is that the last baby boomer will reach age 65 in the year 2030, which isn't that far off now. We also know that here in the state of Ohio, that the percentage of older adults, meaning persons over 60 years of age, has grown exponentially. In just 11 years ago, in 2010, older adults comprised about 17 to 18% of the older adult of the population, overall population in Ohio. And by 2030, it'll be pushing almost 27%. So issues of aging really are quite relevant to us in Ohio. We're the 8th fastest growing state in terms of our older adult population. So, and I think too that many adults, as we're all aging, and more of us, we're facing such issues. You've heard of a silver tsunami. I don't particularly like that, but you hear that, meaning that we are going to have an awful lot more older adults, and that we're coming, and that we're going to make a big difference in our world. You'll see too that this notion of work and retirement, really baby boomers are changing this dichotomy. It's not get to age 65 and retire anymore. People are working longer for various reasons. They want to, they have to for financial reasons, but really are redefining the workplace. And then in the far right corner, I'm showing you some actual and projected net Medicare spending that just shows, again, exponentially how Medicare spending, which is the driver primarily of healthcare for older adults, and how that's growing as a larger and larger part of our gross domestic product. So you'll hear lots of conversations. It's not challenging to hear conversations anymore in the news or in the media around the baby boomers and the impact that we're having on healthcare and on society in general.
Yeah, I know. I read somewhere that the huge amount of our budget, especially in the state of Ohio, that goes to Medicare and Medicaid expenses. And, I kind of shudder to think what it's going to be like by 2030 or in the next coming years. I know I had a guest last month, I believe it was, where she said in 2040, we will have more people in Ohio turning 85 than we will have turning 18. And I was, just kind of makes you take a step back and think about what's going to really be happening and the importance of that. So when we look at some of these Medicare and Medicaid spendings, I think it's really important that we look at things that are causing us to have those expenses and how can we be proactive on taking care of our health.
Absolutely. So some of what I wanted to talk about today in terms of taking care of our health really is how do we age gracefully? And it's challenging to talk about that without talking about heart and brain health and the overlap here. So what you'll see right here in the middle of this picture is kind of the missing puzzle or piece, if you will, to brain health. And although we know an awful lot and really science has gone very far in terms of what we do know that it contributes to heart and brain health, still an awful lot we don't know. But what I wanted to share with you today are some of what we do know and some of the best recommendations for maintaining heart and brain health.
Where do you want to start with this? I mean, I know that there's lots of you talk about heart and brain, and so there's got to be a lot of things that feed into that.
So what I want to start with is a picture is worth 1,000 words. So let me show you some pictures. In the top left corner, what you'll see on the far left side is a normal brain. And what you'll see is a brain that is full, looks kind of cushy, very robust, high volume. What you'll see on the right-hand side and on the lower side is a brain with Alzheimer's disease. And what you'll see is that it has more crevices, it's not as deep, it's not as full. And that really is what a brain looks like with Alzheimer's disease. So what we want to do is keep our brain looking healthy on the normal side on the left. Then on the very bottom of this, you'll see a healthy heart. Nice, red, full of blood, not much fatty tissue there. On the right, you'll see a damaged heart. A lot of fat, and that really is what it looks like. I've been in the operating room, and that really is what it looks like. It's that fatty, what you would expect. And so what we want to do is keep ourselves on the left-hand side of things, right? We want to keep our blood flowing well. We want to keep a heart that's robust, that's pumping well, that's able to maintain our blood pressure well. And so then on the right is how can we have a healthy heart that helps us have a healthy brain as well. So what I thought I'd start with are a couple of pieces of evidence that we have and some recommendations for that. And I think what everyone recognizes first is physical activity, right? That's always seems to be the very first recommendation. And there's a reason for that, because physical activity works. We know that. We've conducted many, many randomized controlled trials. We know that physical activity does help maintain both heart and brain health. What we know about physical activity is that it promotes memory, it increases brain volume, and remember that last picture I showed you. So we want a nice, robust, big brain, if you will. We have greater white matter. That's some of the neurons in the brain that we want to maintain that integrity, and it increases executive function. Now, executive function is a kind of a fancy term for just saying it's a notion that people can, for example, driving. Driving is a very complex skill. You need to know how to turn on the car. You need to know how to put it in reverse. You need to know how to get to where you want to go. All of those are really complex brain activities. And physical exercise really does help us maintain that integrity in the brain, allows us to continue doing these executive function activities. We also know that physical activity can counterbalance some of our genetics. There's a gene, an ApoE4 gene, that has been associated with Alzheimer's disease. And yet you can have this and not get Alzheimer's disease. And why that is, we know that physical activity can kind of counter that. So again, another reason, even if you're genetically predisposed to having Alzheimer's disease, physical activity really can help you kind of counter that. We know that omega-3 fatty acids, you'll hear a lot about that in dietary supplements, that when we ingest more of those, that can, again, make up for heart and brain effects of lower physical activity. So if you're unable to really participate in physical activity, there's some dietary supplements you can take that mirror those same effects. And we know, too, that mind-body techniques, Tai Chi, meditation, show cognitive benefits as well. So really the whole spectrum of physical activity, from moderate intensity, and we know that the recommendations are for 30 minutes a day for at least 5 days a week, so 150 minutes total. But those can be in 10-minute intervals. So it's not like you've got to take a lunch break or take a day, half a day and go take a walk or run or do whatever you're going to do. They can be in small bouts, get you to the same place, and really incredibly important in terms of heart and brain health.
When my mom was still with us, and we would encourage her just to try to walk to the mailbox and back on the first day, and then make it a little bit longer, or maybe do a couple of trips back and forth to the mailbox. But, people, I think, get discouraged when they hear that 30 minutes a day, that I just don't have the time to set that apart. But, you can do 10 minutes here or 7 minutes and just get at that accumulation in there as well. And talking about physical activity and brain health, a lot of times we talk about how it helps defeat depression, right? It helps with your mental health, even the physical activity. And so do you have some things that we could share and talk about with as far as supporting treating depression?
Absolutely. Vitally important to treat depression. And what we know is that we're increasingly more primary care providers are screening for depression. So very important to diagnose it, to recognize it, and to seek help. What we know in people who are depressed, who do not seek help, is that they have higher incidence of arrhythmia, of extra heartbeats that can be very damaging to the heart. They have a higher incidence of having a heart attack or a myocardial infarction. They have higher incidence of heart failure and sudden death. So really, truly, depression is bad for your heart. In terms of depression and the effects on brain health, depression invokes inflammatory pathways that can lead to lower brain volumes and the whole cascade, as we've talked about before. There is, in fact, a theory that maybe depression is on a continuum that starts with depression. Maybe depression that goes untreated leads to mild cognitive impairment and to dementia. So again, vitally important to recognize, be screened for, and get treatment for depression. It is a common geriatric syndrome, so it's nothing to be embarrassed about. It is a chemical imbalance, just like you would treat a chemical imbalance like diabetes. We really are advocating, we want people to recognize that. Don't be stigmatized by it. Move forward and get that treatment. It really does make a difference in brain and heart health.
It's really important to talk about that too, because a lot of older adults don't want to admit that they have some depression. And I think sometimes if they're going through grief, it mimics that forgetfulness and those feelings of am I starting to have dementia? And if it's a prolonged grief, then they should go ahead, like you say, go out and seek some help and talk to someone and get some relief from some of the things that they have.
Absolutely.
So I think another aspect so much in our wellness is our social health or our relationship health. And, with older adults, it's something too that we really need to try to encourage. And I think it's a little bit difficult right now during COVID. But can you share a little bit about the importance of those healthy relationships that people have?
Absolutely. So healthy relationships, it's certainly good for your mood. And so we've just talked about depression. It's also good, at a as a cellular level. People who have healthy relationships feel good about their relationships. Their wounds heal faster and better. They have, and we wonder why that might be. And it's people in healthy relationships too seem to have less inflammation. And we know that chronic inflammation can lead to a myriad of disease states. The notion too is maybe the nag factor. When I say that, I think about my husband and how I'm nagging him often to go take a walk and be healthy. And so there is this notion that a healthy relationship helps you overcome some maybe of the barriers that you're feeling to taking care of yourself. And that a little bit of nagging might go a long way in terms of promoting heart and brain health.
Good. I'll have to tell my husband that. So, what are some of the evidence then that we have about social engagement? What is some of the stuff that the science is telling us?
So what we know about social engagement is that it's good for you. It's good for your brain. It's good for your heart. And what we've recently learned too is that I know in the past people have asked the question, is it better to have a small circle of friends that you're intimately close with or a larger circle of friends? And we're starting to get some evidence that in fact, a larger circle of friends is really what's helpful. And when you think about it, it's because a larger circle of friends, you get more of an opportunity to talk about different things, to engage in different subjects. You know, I have friends that like to read books, and I have friends who were rock climbers, and I have friends who are doing all kinds of different activities. And when we talk about that, it really does seem to stimulate different parts of people's brains. So again, this notion of social engagement, while I don't want to tell anyone, to give up on their small circle, I want to encourage people to enlarge that circle. Because by enlarging that circle, you really do learn more. And we know that learning, cognitive stimulation is helpful for brain health, helps with chronic inflammation, really does build new synapses. So again, there's robust support for social engagement. And we've seen that kind of the reverse side of that throughout this pandemic. People have been socially isolated. Incidence of depression is very high, anxiety is very high, and we know that obesity is on the rise and that depression is on the rise. So again, anecdotal evidence from the pandemic that this all makes good sense.
We talked about some relationships, and we talked about the importance of being engaged socially, but you also mentioned something about obesity being on the rise. So what does nutrition play into this conversation, and what do we need to be concerned about, or what do you want to add about nutrition and your brain health?
Sure. So there's good evidence around nutrition and brain health, and what I have here are some of the diets. The Mediterranean diet, I think for years we've known that people in Europe tend to have lower incidence of cardiovascular disease and then brain disease as well. There's a DASH diet that stands for Dietary Approaches to Stop Hypertension. A MIND diet, which is essentially a Mediterranean diet that's rich in olive oil, nuts, grains. The MIND diet takes it a step further and talks about berries, adding berries into your diet, wine, and some whole foods as well. So, and then I've already spoken of the dietary supplements, the omega-3s that can be helpful. So we know that dietary interventions are meaningful. They certainly help with cardiovascular health, decrease atherosclerotic plaques, which are the plaques that plug up your heart and really then plug up your brain. If you've got atherosclerosis, it's just not limited to your heart. And I think that's something that oftentimes older adult thinks that I got a stent or I got a blood, a bypass, and now I'm fine. Well, actually, you're not. It's a process. So we've opened up, maybe the physicians have opened up some of those initial clots, but the process continues throughout your body. So really, nutritional interventions can help halt that and really reverse that course. So good nutrition matters.
And I know that if people are interested in learning more about the MIND diet, there's lots of resources that are out there that they can access through Ohio State University or through Extension. We do have quite a few things out there related to that as well. Mm-hmm. So I think that people have those options. So you mentioned a few slides back about stress and inflammation in the body. I know that there's a lot of stuff that tells us that chronic stress is just not good for us. So what can you share with me about stress?
So if you're living and breathing, you're under some stress, right? And there's really a difference between good stress and bad stress. So for example, I'm a little stressed right now, but in a good way, because I'm, talking to you all and, a little out of my norm for the day. So that's a good stress, and it typically heightens, of course, now I'm struggling for words, but heightens attention. It really makes people more open to the evidence that's there. And it again, heightens attention and heightens really poise, if you will. Now there's a tipping point. Too much stress then really gets you into a chronic state can lead to anxiety and depression. And we've already spoken of that. It certainly has an inflammatory response then in your body. An inflammatory response raises blood pressure, can cause more plaque to accumulate, and really can then decrease memory and your executive function. So there's good evidence to support stress reduction. And I think much of this is because what we talk about in terms of stress reduction is getting out there and be physically active. Again, helps your brain and your heart. We talk about doing mindfulness-based meditation, something that can really dampen the kind of fight or flight response that we have when we're under stress and activates, instead of our sympathetic nervous system, our parasympathetic nervous system that is really a relaxation response. So we want more parasympathetic response. And the ways that we do that is through exercise and through other stress reduction techniques.
I noticed during the Olympics, I was watching the gymnast, Suni Lee, who ended up winning the gold medal. If you notice, while she was waiting to go and they could put her in the holding pattern, she was holding her stomach and she was measuring her breath. And I was like, she's doing mindfulness practices right there. And so I think it was really neat to watch her control her stress by some of the things that we talk about all the time. And I was so excited. I just wanted to cheer for her. But, and I know that stress also really affects sometimes people's sleep. Mm-hmm. And so what about sleep and brain health do we need to really consider and think about?
That's great. So absolutely. And increasingly, sleep health is really becoming very prominent in science and in the news. So that we know when we sleep, we really are consolidating our memories. And so when you're not sleeping well, your ability to remember and to recall is not as good. We also know that when we sleep, we have blood pressure reductions, right? We're getting that parasympathetic response. And so if you're not sleeping well, your blood pressure remains heightened for longer than it should throughout the day. We know that people who don't sleep well have a higher incidence of diabetes and of obesity as well. Now, there are many ways, so I tell people too that people often, you acclimate to poor sleep. You think, well, I've always been a poor sleeper, but it really is something to discuss with your primary care provider, because there are ways that and there's some initial evidence that if we can treat some of the sleep disturbances, particularly obstructive sleep apnea, through CPAP or other measures, that we can reverse some of the memory decline that's going on. So again, vitally important that you get a good sleep. And there are so many ways that you can do that. Drinking less caffeine, having a normal wake cycle, exercising helps reset sleep. Sleeping in a dark room, a cool room, all of those kinds of things really matter. Watching minding the screen time that you're doing, either computers, television, or whatever. You really need to dampen that as you're getting ready for bed. Not eating big meals right before bed, all of those kinds of things. But sleep health absolutely affects heart and brain health.
We talked about all these different things that really talk about healthy aging and our brain health and our heart health. And so is there anything else like you want to share or talk to us about when it comes to just healthy aging, just in general? I know it's a huge umbrella, right? That we all need to see, try to reach those markers. But what are some of those things? And I love this slide. I saw this earlier today. So
great. Sure. So really healthy aging is a combination of many factors. And I think it's important to know that some days maybe you're better with exercise or diet than you are. Certainly genes is not something we can do something about, in terms of we're born with the genetic makeup we have, but there are ways that we can help make up for maybe bad genes in ways through dietary supplements and through all of these other pursuits, through exercise, through social engagement. All of these really are parts of the equation for healthy aging. And you do need all of these to age well and gracefully. And I love this quote that George Burns has, that you can't help getting older, but you don't have to get old. And I think that, by paying attention to all these factors that affect brain and heart health, that you really may get older. In fact, we all are. But in terms of your body and your mind and your ability to continue to be active and pursuing the kinds of things that are meaningful to you, by doing these heart and brain healthy activities, you really do give yourself a leg up in terms of not getting old.
I just we have just a few minutes here left, but I have these random thoughts that pop in my head sometimes.
Okay.
And I keep thinking about, we have some local community gardens here in Clark County. And I have watched them evolve over the last couple of years. And some of the people who really looked old to me when I first started working there, as the years have progressed, they seem to have gotten younger. And I go and I look at this and I'm thinking, they're getting physical activity, right? Because they're out there working in those gardens all the time. They're eating more healthy because they're growing that fresh produce and they're more likely to eat it. And then I see them giving back to other people, to the newer gardeners or to the younger generation. And I'm like, this is that emotional health and the, widening the people that you interact with. And I just think it's so neat to watch this evolve out there. I saw someone the other day and I was like, oh my gosh, she looks probably 6 or 7 years younger than the last time I'd seen her. And I just think it's really incredible. And so, when older adults are looking for those places to do those connections, is finding things to volunteer with, or, searching out new passions even would be something that could help you from just sitting in the chair and getting old at home.
Yeah. You bring up a great point, and that's probably a great representation of healthy aging. The healthy gardening, being outside, getting some vitamin D that helps, with our bone health, engaging, as you said, with others, maybe learning new skills. Certainly cognitively stimulating. So you don't have to only do puzzles and Sudoku. It's ways of new gardening techniques, passing on that information to others. And as you said, some physical activity. I know I pulled weeds last night and pulled in some tomatoes from our garden. And that was a pretty good workout, along with my mother, my 85-year-old mother. So we had a grand time doing that. And so I think that all of those, you can really incorporate healthy aging techniques into your everyday life. And that's what we want to do, live a life that incorporates all of these, that this isn't an appendage, something to do for 30 minutes a day. It really is a way of life. So thank you for sharing that example.
So if anyone needs to find out more information, they can contact me at the Clark County Extension Office, or they can contact Dr. Rose. And I want to thank you again so much for taking the time to talk with us today. I know that this is something that can really benefit a lot of people, and I really appreciate it.
Well, my pleasure. Thank you.
Thank you.